Hi, and welcome to week 2, Ethical Principles and Advocacy. Our student competencies this week are to demonstrate and advocate professionalism and accountability for assessing nursing management problems, to identify a current ethical management problem in our work environment, to assess the factors contributing to management function and/or dysfunction, to plan and implement solutions to solve the leadership problem utilizing ethical principles, problem solving, and evaluation, and to advocate for professionalism and accountability to enhance the climate in nursing practice environments. The American Nurses Association Code of Ethics and Personal Standards are listed in our textbook in our chapter reading. But I was just wondering how many of you have read these prior to pursuing your degree? And does your facility have them available anywhere? Maybe they're posted somewhere publicly, or maybe in a break room, or at the nurses unit, or maybe on the intranet. And also, have any of you ever taken part in an ethical decision-making process at work with the aid of your facility's ethics committee or council? And do you know who the members of that are? Or do you know how to get a hold of the ethics committee or council if you needed them? How often do you witness an ethical issue in your daily work environment? Remembering that ethical issues are more than just patient issues. It's more than just issues with patient futility or pain medication or informed consent. It also is things like, are we delivering safe and competent care? Are our caregivers safe and competent? Things like diversion, things like staffing and lack of staffing. Lack of collaboration between team members, disrespectful communication. You know, we've all heard or probably experienced what's called bullying or horizontal violence. It can be issues with informed consent. Sometimes when the physician is having a patient sign a consent form, we may not really think that this patient is informed or is able to sign a consent. Things like triaging, which patients are seen first, recruitment and retention of healthcare workers, and whistleblowing. These are all examples of ethical issues that you could see in a workplace, and there's many more. I'm sure you can think of many more. This is a quote by Oprah Winfrey, but it's also a spin-off of many other quotes that I've seen. But when we think of integrity as ethical behavior, real integrity is doing the right thing, knowing that nobody's going to know if you did it or not. So whether somebody's looking or not, it's doing the right thing. There's a lot of harrowing questions and ethical dilemmas in this book that I read, 5 Days at Memorial. It's about a hospital during that storm and the 5 days following it. So they lost power, they ran out of medications, they couldn't use ventilators, elevators, ran out of IV meds. The workers there were stranded, and they couldn't leave. Patients were stranded. And one of the things that some of the physicians and doctors decided to do was to medicate to the point of euthanasia for several patients that were very, very sick. It's a very interesting read, and if you do read it, you may be surprised at the ending. Another thing in our readings this week is emotional intelligence. It's such a big thing in corporations and hospitals now that we've even started teaching it in our current preceptor program. But emotional intelligence actually has much more to do with whether you're going to be successful at a job than IQ. When you do the reading and see the 5 components of emotional intelligence, you'll see why. And also, have you ever taken an emotional intelligence quiz? If you haven't, I encourage you to do so. They're kind of fun, and it's kind of fun to, explore yourself that way. I didn't want to put one in this PowerPoint, but most of them, you need to take them right on that site. You can find many of them online. Also, malpractice is a topic in our readings this week. And think about if you or anyone that you know has ever had to take part in a lawsuit or a deposition. And I can tell you that I was deposed once several years ago, and the matter at hand was something that happened several years before that. So I'm a huge advocate for accurate documentation, because 4 years later it's very hard to remember what happened in the specific incident that they're deposing you on. And advocacy. So think of all the times that you've advocated for a patient. I know that as nurses we do that all the time without even thinking of it. But we also advocate for family members, we advocate for colleagues, and we advocate for our profession. A lot of times we see the nursing profession on TV shows or in the news kind of being bashed. But again, advocacy is something that a lot of times it just comes natural to us. We do it because it's the right thing to do. And this is just a picture of me and my granddaughter Iris, who is a little over 2, and she makes me happy to look at, so I thought I would put it in this video as well. So have a great week, ladies, and I'll see you online.